Hello, my dog lovers. Hello, how are you doing? I am here after broadcasting on a different channel. I just basically discovered that after 6 minutes of being online with Alicia, and I thought I was with you as well, I was broadcasting on my personal Facebook page and didn't realize it until my team members started letting us know. So today, first, I want to apologize for being late. Second, I would like to talk about urinary incontinence. And there are many dogs out there who are waking up at night with a little spot under their bum and they don't know what happened and they're embarrassed. And so are their people because sometimes it's messy and sometimes it happens in places when they visit family and so on, and it can be really difficult. The whole story of my discovery of urinary incontinence treatment, quite different urinary incontinence treatment, goes as far back as 2000. And the reason why I remember that so well is that yesterday I went into my files. In the file of the patient that was urinary incontinent and I couldn't figure it out. It actually took me 2 years before I figured out what the problem was. And I followed all the treatment protocols and I followed all the textbooks and everything that I was taught, and it still did not work. And I was very frustrated. So Cass, that was the dog's name, was my huge teacher when it comes to this very stubborn and very common problem. And Cass's story started a few months before I met her, because she was owned by by people who had the really bad idea of putting her on a truck and actually driving around with her on the truck bed. Now, those people eventually end up bringing Cass to veterinary hospital for very severe injuries. She had something that we call degloving injury. When she was dragged behind the truck, she actually stripped the skin on her feet. And I don't want to gross you out, but also do not want this to happen. And every time I see people with their dogs on truck beds, I get really angry. Those are some of the moments that I get really pissed off. And these bozos, unfortunately, quite often ignore my suggestion that it is not safe. Sometimes I have a conversation with them and they just don't really understand. But if they saw what I have seen in the 30 years of my veterinary job, they would understand. So poor Kaz, and this is not her picture. This is a picture of another dog, but I just don't wanted to have a visual here. Poor Kaz ended up with in a veterinary clinic with these people who had her on a truck bed, not having enough money to pay. So she was given up. And luckily, my client and now my friend adopted her. It took us many years to actually a couple of years to solve the problem. And yesterday I actually called her. I thought, wouldn't it be nice if I saw how Pat was doing? Obviously, Cass is not around us anymore because it's been more than 20 years. But Pat was, and we had a great conversation. And she's a lovely, lovely person and a client. And that was the beginning, basically, of how I discovered urinary incontinence. But I know that you're probably curious to what happened and what I discovered. So in conventional medicine, they teach us that urinary incontinence is basically a lack of bladder, or caused mostly, not always, but mostly caused by lack of bladder sphincter tone. And that happens when the estrogen hormones drop after dogs being spayed. And while this is partially true, it is not the whole story, because only about barely over half of dogs that are treated for urinary incontinence with hormone replacement actually respond. So I will take you through first the Western treatment of urinary incontinence, and just kind of give you an insight how it's addressed. And then I'll tell you a little bit more about diagnostics and what I discovered. So the urinary incontinence is normally treated with hormones. And the drug that we use and has been used for many decades is called stilbestrol. And stilbestrol is actually a hormone replacement. It does have an ability to enhance the sphincter response. So it makes it a little tighter. That's good. Unfortunately, it causes hair loss and bone marrow suppression, which also reflects blood cells and immunity. And it's also carcinogenic. So this is, from my perspective, not the treatment that I would like to use as the first line of defense. Unfortunately, in veterinary medicine, when you go to the treatment protocols, it is very, very commonly used. Now, there's a newer drug that is used, and it's called Proin, phenylpropanolamine. I always have difficult, hard time to pronounce these words in English, because in Czech, in my native tongue, it would be pronounced a little differently. But Proin is easy, and what Proin does actually, it has a function, or it basically makes the bladder more loose or more flaccid. Okay, so if you have a balloon, and the bladder is a balloon basically, and there's a certain point, certain threshold when it expands, then the nerve fibers register and the whole body registers, the nervous system registers that it actually expanded, and then it starts contracting. But it is not very voluntary, right? The bladder is not voluntary. What is voluntary is the sphincter. So what this drug, the Proin drug, does, it actually makes the muscles of the bladder more loose and more flaccid, right? So that's not really the greatest thing, because if we have bladder walls that don't function properly or they are a little weaker, then the bladder doesn't empty as well, and there may be more urinary tract infections and all that. So you can see what we are doing actually here. We are actually increasing the strength of the sphincter, which is great with the stilbestrol, but it's a carcinogenic drug. And with Proin, what we are doing, we are making the bladder more flaccid. Plus, they say that it is not effective in dogs with incontinence due to neurologic disease. And this is something that I actually took from the label of the drug, from the drug label. And I was really puzzled by it. So then I went into some continuing education proceedings and tried to see whether the specialist, the urinary tract specialist, actually mentioned anything about what I discovered in the course of treating cats and trying to figure out what was going on. And again, they just said, it's due to low estrogen hormones, and sometimes there can be some other problems, which I'm going to tell you, like urinary tract infection and maybe urinary stones and all that. But no one really talked about what I discovered. And it was puzzling because, I just kind of looked, and it was not that difficult to see when I saw what I saw, but I was really puzzled that nobody actually pointed to it in the proceedings, in veterinary conferences and all that. So what happened with Kaz? I treated her and treated her and treated her, and she continued being incontinent. And her skin injuries helped and all that stuff. And she was a lovely, lovely dog. I loved her. I really miss her. And one day, and I was kind of going through the file yesterday, so I know that in October 2002, I finally figured it out. And it happened after about 1 hour of dog walking with my friend and client. I said, why don't we just go for a walk, and I want to see what you do with her. And we went to this park, and Pat, she loved Cass very much. She pulled out the ball, and for the next half an hour, she was throwing the ball. And then Cass came to the car after we were done with the walk, and she peed in the car. And that happened repeatedly. Pat said, it always happens after a walk, and I have no idea why it happens. So I discovered that her urinary incontinence was actually not caused by low hormones, but it was possibly caused by a combination of her being compromised by the accident, and her back was compromised. And it was also caused by this little culprit. I'll show you right away. Just a second. Whoops. A tennis ball. And it was such an aha moment. I was going, wow, the bladder sphincter gets weaker when she runs. So she gets exhausted. Her sympathetic nervous system, which is the sphincter managing system, gets a little more relaxed. I'll give you actually a little more explanation of that because it is needed. So there are two different systems. There is the parasympathetic nervous system that governs the guts and the walls of the bladder and all that. And then there's the opposing one, which is the sympathetic nervous system, okay? And the sympathetic nervous system actually governs the muscles, like muscles on your legs, and also the sphincter, the voluntary muscles. And they usually go like this. It's either one is up and one is down, and so on. So if I have a dog that gets really, really exercised a lot, the sympathetic nervous system goes down. Guess what happened? The parasympathetic nervous system goes up, and the bladder is more toned, but the voluntary muscles are less toned because they're part of the sympathetic nervous system. So it's like yin and yang. See the sympathetic nervous system as yang, and the parasympathetic system as yang, yin, yang. Okay. Anyway, so she exercised, she relaxed, her sphincter relaxed, but her bladder tone was higher, right? Because in the relaxation kind of period, usually the parasympathetic system is more active. So that was one part, but most dogs exercise and they're not incontinent, right? So it was still a little bit of a puzzle. But as a result of thinking, okay, so she's exhausted after the exercise, I need to do something to actually address her exhaustions and maybe the exhaustions of the muscles of the whole body. So what I did, I actually gave her a homeopathic remedy. I've practiced homeopathy for a long time. I know that some people say that homeopathy doesn't work. Well, I've had two really clear occasions when I saw homeopathy work without any doubt. One of them was hyperthyroidism in cats. That's the high thyroid gland hormone in cats condition, very common. And I treated about 15 cats. I did a study. Half of them reversed back to normal. One of them was my cat that lived until 21 without any medication for hyperthyroidism. And she was diagnosed at the age of 8 years, sorry. So that was one. And second was urinary incontinence, where these dogs basically stopped peeing after I've given this homeopathic remedy. This was Cat's prescription, phosphoric acid 200C. And I'm not going to get into crazy long explanation of homeopathy, but homeopathy is based on the principle that likes cures like cures like, and also on the principle that certain substances from nature, whether it's minerals or plants, can address certain conditions by basically administering them in a very dilute form. And you can look up homeopathy and how it works. Well, phosphoric acid is actually a remedy for exhaustion. It is also a remedy for loss of friends and loss of family, grief, and all that. So when I looked at Cass and I saw that she was basically responding to exhaustion by peeing, and that she also lost her family, that she had a major change in her life, I gave her this remedy. And after 2 years of me not being able to solve her urinary incontinence, she stopped peeing. So then I started looking a little further into the anatomy of obviously the bladder and the sphincter. I knew much of it from school, but I just kind of wanted to refresh myself and basically confirm that the urinary tract or the bladder sphincter gets its nerve supply from the back or rear portion of the lumbar spine, that it gets also very much stressed when dogs run and chase the ball. I've seen that over and over and over because dogs slip and slide, they twist their back. You know, you've seen the dogs running to the kind of like slipping to the side when the dog runs. And also the muscles along the spine get really tight because when a dog chases a ball for half an hour, 45 minutes, this is not a natural exercise. And the muscles get tight, and guess what happens? The nerves that go through the muscles get pinched, and the bladder sphincter nerve gets pinched. And what happens to the sphincter? Well, it numbs out. And I know many of you go, well, but you know, my dog got incontinent after spaying, and I know they do get incontinent. And I will show you a little image just a few slides later to kind of show you the connection between those two, between spaying and the back. So once again, this is another kind of image of nerves. And you can see that the nerves kind of from the spine go along the ribs here. And they usually supply the muscles and the skin and the organs in that area. And the bladder sphincter nerves come from right about here. So I did copy a little excerpt from the conference proceeding because it was very interesting. So they say that that the treatment of the medical options of treating urinary incontinence are aimed at increasing the tone of the urethral sphincter. So they basically look nowhere else, right? Even though in Proin, on the label of Proin, they say that doesn't respond or doesn't help in dogs with neurological disorders. So one would think, okay, they probably kind of check the nerve supply to the bladder and all that stuff, and nobody talks about it. Instead, they gave stilbestrol or give stilbestrol, recommend stilbestrol. That is carcinogenic, and that may increase the sphincter tone, but nobody looked at the spine, which is absolutely mind-blowing. In the proceedings, they say that only about 61% of dogs will be fully continent or will not pee anymore. And if you think of the hardship and the embarrassment of our dogs if they are incontinent, and also the soiled carpets and sofas and beds and urinary tract infections because the sphincter is looser. This is one of the examples where I go like, wow, what do we do as professionals that we don't notice these simple things? And it also took me 2 years to find myself, and I should have probably glued in it immediately. But I was taught that basically I should use hormones and that's it. And I was not really taught as a student that there may be some other causes. Much of the treatment plans or medicine that I have been practicing for the last 2 decades have been basically derived from just searching frantically for solutions because what I was taught was not working. And so then I developed my own system where I just used simple observation and common sense. Now, there was only in my case of using the phosphoric acid, I had only one patient that didn't respond. I'm sorry, my headset is actually discharged. I think I'm going to have to switch to the computer. Alicia, are you hearing me still?
Yes, it's a little bit lower in volume, but I can still
I
hear
cannot
you.
hear you, Alicia.
Can you hear me now?
Alicia?
I think if your headset's maybe still attached to the machine.
Okay,
Yeah,
sorry.
can you?
It's so I'm gonna see it, it'll probably eventually die, the headset, so I'll it'll switch to the computer. Anyway, so I had only one case of urinary incontinence that didn't respond to the treatment that I discovered. And that was a dog that lived in Squamish, BC. And Squamish is the outdoor capital of the world. Alicia is really nearby in another small town. I will not be disclosing, Alicia, where you live, because what if what if you have suddenly like hundreds of dog lovers wanting to meet? Anyway, this dog was a biking dog. The owner loved biking. And this is a very common thing that people take dogs and they go for a 20K ride up and down and up and down. And those dogs try to keep up. I knew that this dog was exhausted and overexerted, and that's why it was incontinent. And most likely the lumbar spine was also affected. And you know what? I had the clients coming back and saying, it doesn't work, but they kept biking with the dog. And I said, you have to stop. And they didn't. And eventually the dog got completely ruined. And I basically was so frustrated. It was so hard. So if you have a dog that likes to bike with you, run, this is not the right exercise for dogs, because dogs would not be running in this kind of pace for an hour or two. This is too much, and dogs get ruined too often, and not just with urinary incontinence, but generally their health, their mobility. By the age of 5 or 6, they're stiff and decrepit, and they slide down like there's no tomorrow. And I do think that it can take away years of healthy life of an average dog. So, tennis ball, frisbees, another thing. I have seen so many dogs chasing frisbees and ball. Almost every day I go to the beach and there's a dog chasing a ball. But there are no dogs or wolves in nature that would chase 20 or 30 or 40 rabbits in an hour, right? And for dogs, the frisbee is a rabbit, the ball is a rabbit. Um, and the biking person is the person that is running away. So they need to keep up. I did mention that I will disclose why spay is related to incontinence. And I don't necessarily deny the fact that the low hormones will actually predispose dogs to incontinence, because estrogen hormones are important for the tone of the bladder sphincter. But the reason why many dogs do not respond to the supplementing of carcinogenic estrogen is that most commonly, this condition is related to lumbar spine. And it took me some time to kind of see, okay, so dogs get spayed, okay, hormones drop, but why doesn't it respond to hormone replacement quite often? Even though the dog started being incontinent after getting spayed. And the reason I think is that dogs are quite often tied on the surgical table. And I didn't find any other picture than this one, but the legs quite often are much more stretched. And what happens, it's a very unnatural position for the dog's spine. And when they're stretched, basically the lumbar spine, if dogs are kind of upside down, okay, now we are upside down. The spine, like when he stretched one side or the rear end, the spine goes like this, right? And it will actually subluxate or misalign the lumbar spine. And when we have this kind of injury, it's often undetected, but it often happens when dogs are stretched too harshly on the surgical table. So if you have a puppy that is going to get spayed or neutered, just make sure that you talk to the staff and say, I've heard that too much stretching on the table can cause some problems in the lumbar spine. Can you please be gentle? Can you put a lot of padding? Can you put a foam or blankets or something like that before my dog is stretched? I know they will look at you and think that maybe that you fell off a tree and that you had a head injury. No, you're actually making sense because this commonly happens. The problem is, I've shown you all these that people don't really like to be taught or told what to do. People love their dogs, and they don't want to stop throwing the ball because we dog lovers are so prone to serving our dogs unreasonable, harmful addictions that we don't know how to stop. We see our dog, he's asking for a ball, and we will throw and throw and throw until there's a physical and emotional damage. It is so hard that I think it's probably harder than stopping. I never smoked, but I think it's probably harder than stopping smoking, or maybe even harder than stopping drinking. Because if you have a dog that really wants something and you love the dog, it's almost impossible to stop. I found this dog lover when I was traveling in Europe a couple of years ago, and I discovered this picture, I don't know, just about a couple of weeks ago. This is how much we love our dogs, okay? We put a tattoo of our dogs on our legs, and we do all sorts of different things. We buy them the most expensive foods and the best supplements and the best clothes. Sometimes we do, I get up in the morning and the first thing is I go and make sure that my dog is happy, and then I can do everything else, right? How can we deal with this impossible, what I call monkey love, something that we do doesn't really serve our beloved dogs, but we do it anyway because we can't help it? How do we deal with that? Well, I think that if we have a dog addicted to any kind of activity that is harmful, I really do think, honestly, that this is a situation for talking to someone who knows how to deal with our own emotions around it, right? And then we can possibly help them, because sometimes it does lead to injuries and shortened lifespan and incontinence and all that. So as a result of me discovering almost accidentally or just curiously how to deal with urinary incontinence, we came up with a product which is called Incontia. And Incontia was basically a treatment protocol with a homeopathic remedy packed and packaged and so on. But then we realized that many of you live outside of the United States and Canada, and it was difficult to ship homeopathic remedies. So we thought, okay, we're going to basically offer the digital protocol, kind of a digital ebook with everything that needs to be done during the treatment plan. Because even though I've given you the kind of the gist of it, you really need to be very diligent. If you have an incontinent dog, you have to be diligent and follow the plan. I have had the idea that I could possibly give it out for free. But as you know, people often do not value the things that we give for free. At least I've noticed that. I have courses that are absolutely fantastic and that could save probably, thousands of dollars of an average dog lover's vet bills. And if I give these courses for free, they're not as popular. So I decided that we'll sell Incontia treatment plan for $9.99. So it's just to maintain the website and maybe pay one finger of one of my team member to be alive. Just kidding, but you know what I mean. It's not a lot of money, but it will give you a very detailed protocol if you want to use it. But to say that, I will actually give you a summary of this protocol right now here, because I think you deserve it, and I don't want you to think that I'm keeping this secret, because it's ultimately about our dogs and their health. And if you cannot afford $9.99, you'll have roughly a summary of what we do. So if you have an incontinent dog, first you have to ask your veterinarian to do physical examination. Even though I want to point out that most of us veterinarians have not been trained to recognize a slight misalignment or subluxation of the lumbar spine. So I would also recommend that you'll do physical exam with a physical therapy chiropractor or someone who does have an ability to assess the back. But your vet will do chemistry and complete blood count and thyroid gland evaluation and make sure that there's no kidney disease and all that. And also make sure that we do urinalysis to check for urinary tract infection. So that's the first step. And when it comes to the urinary tract and the bladder assessment, I'll give you actually another little screen here. So you can make notes, take screenshots. When it comes to urinary tract infections, quite often urine culture is not done. And that is a mistake. You know, in most veterinary clinics, what they do, they collect the urine sample, they collect it by free flow, but there can be contamination from the urethra or from the vulva. Therefore, I usually recommend having the bladder nice and full, wake your dog up, take them to the vet right away, and collect the urine sample by a needle. It's a very simple procedure. It doesn't cause any harm. It's really simple. Dogs don't have a lot of sensitivity there. Also, if there's urinary incontinence and doesn't seem to be responding, you want to make sure that there is no polyp or growth inside of the bladder. So an ultrasound sometimes may be necessary if things are not going well. Genetically, some dogs actually have a ureter, or the little tube that goes from the kidneys to the bladder, attached in the wrong spot, in incorrect location beyond the sphincter, right? So the urine is basically leaking from the kidneys directly to the urethra, and it bypasses the bladder. So that's something which is called ectopic ureter, and you would need to kind of figure that out by contrast study and with your veterinarian. But those are kind of marginal causes and not very common. Urinary stones, relatively common problem. I would say that if you want to prevent your dog's urinary stone, don't feed it kibble, don't feed it unbalanced diet. Make sure that you feed raw or cooked food with proper supplements that are balanced. Because if there is one mineral missing, the other mineral may be excreting from the urine much more readily for the body to keep the osmotic balance and the thickness of blood and the body fluids, and it will start throwing off some of the minerals out, and it may generate stones or lead to stones. Excitement and submissive urination is another possible cause, right? Like, you have to distinguish whether your dog is happy to see you and peeing his pants, in quotes, or whether there is urinary incontinence. Hyperactive adrenal glands may also be the possible cause, and we call it Cushing's disease. There's an article on Cushing's disease on my website. So what do you do with the Incontia? I did say that I will give you the treatment plan here. So you give one of the dose of the remedy, and it's actually phosphoric acid 1M. Phosphoric acid 1M, that's the potency. You can get the remedy either in the US in homeopathic pharmacy, or in the UK. You can get it from Helios Pharmacy. In Canada, we usually have it shipped from Helios from the UK. And you give one dose, which is, if you have the little poppy seed-like pellets, about 20, but you don't need to count them. You just kind of estimate roughly about 20. And if you have the mint-sized pellets, you give about 3, and you crush them in between 2 spoons. So imagine my hand is a spoon. You put the pellet here, and you crush it, and then you pop it in your dog's mouth. No food, at least half an hour before and after. Actually, half an hour after the remedy and half an hour before. That's correct. And then the second, wait for 2 weeks and give the second dose 2 weeks later. And then give 1 more or 3 more doses for 3 months, or actually, now I mixed it all up. So 1 dose at day 0, then second dose week 2, at the end of week 2, and then monthly for the total of 3 months, and that should be enough. Now, obviously, you have to address your dog's exercise. You also have to make sure that their spine is aligned and that there is no injury and the muscles are nice and relaxed. One of the ways of treating inflammation is using omega-3s. Now, omega-3s have been scientifically proven to work as well as NSAIDs, the anti-inflammatory drugs, without the side effects of gastric ulceration, liver damage, kidney damage, and all those, and diarrhea and bloody diarrhea. So NSAIDs, I do not recommend at all. I have not been using them myself, don't use them for dogs, and have seen dogs moving well and doing the same way or better than on NSAIDs. You know, when you give NSAIDs for muscle injuries, you basically tell the body not to heal, not to respond to inflammation and injury to the muscle. So the dog starts moving again, but the injury goes on. And the healing doesn't go on because these drugs actually stop it. So I've talked about omega-3 sources before. If you want to watch a documentary called Seaspiracy, it'll tell you what overfishing does. There was one creature that is fortunate because there are fewer fish, and that's calamari. And it's also low on the food chain. So we have opted for using calamari oil for Feel Good Omega. And if I have a dog that is injured, I usually do triple dose for some time until the injury or the inflammation is down. I had to do it with Pax a few times when he got injured by running like a crazy maniac. But it works really well. And I also give omega-3 on regular basis pretty much to him, and I also take them. Another anti-inflammatory medication is turmeric, or nutrient or superfood is turmeric. It appears to act on the same receptors as NSAIDs, but it doesn't seem to cause the same side effects. I've never seen the same side effects. Maybe because it's created by nature, maybe because it's a whole food component, and the drugs are just one little bit. It's not whole food. When it comes to golden paste, I'm not against it. I'm not for it. I don't really like the high content of coconut oil. I know that some of you may love coconut oil. I think it's a little bit of a fad, and I have never seen it being really beneficial too much, except it may help the brain and neurological function to a certain degree. But again, there's some other ways to do it, such as adding omegas. Green leaf mussel. So if you, and I'm talking about mobility here, because if your dog has back injury and is incontinent, then you have to look after the sphincter and the bladder, but also the backbone, the spine. Green leaf mussel is a natural whole food from green leaf mussel, Perna canaliculus. And it appears to have very positive effect on inflammation. It basically neutralizes the arachidonic acid, which is the main component that plays a big role in inflammation. This is my first dog, Sky, and his Auntie Lana, or Dr. Patterson, who's a chiropractor. We used to go to chiropractics with him for many years, and he benefited from that. A person like Dr. Lana, a chiropractor or physical therapist, is probably the best one to assess your dog's spine. When your dog gets older, obviously massage and underwater treadmill and all of that is possible, and making sure that we, keep their core strong. I like using these balancing cushions and so on. Discovered from my personal experience that if I do one-sided exercise and my core gets weak, then my lumbar spine gets sore. I did about 365 days yoga. It was one of my crazy ideas that I would do an hour of yoga 365 days. Well, what I did, I was very flexible, but I weakened my core because I wasn't really balanced in the exercise. So then I started doing Pilates, and I started doing some other core exercises and strengthening, and the back pain went away. So this is, and obviously if I was incontinent, I'm not, I swear, if I was incontinent, I'm sure that it would be beneficial for my sphincter as well. So that's about it. So this is the treatment plan. If you didn't get a chance to take a screenshot, again, the homeopathic remedy is called phosphoric acid 1M. And I am ready to answer questions. Today we've been on time almost. Alicia, are you impressed?
I am so impressed. Thank you.
You're welcome. It doesn't ever happen very often, so enjoy, you guys.
We're in good shape, and we have some great questions from the community as well.
Okay, well, let's go for it.
All right. So the first question is from Chantal. Hi, Chantal. Her question is, what about chronic UTIs in male dogs? I have a Rhodesian Ridgeback that's 4 years old, and he has this issue. Specialists can't solve the mystery. Any suggestions?
Chronic UTIs. Okay, so my sense is that if there are chronic urinary tract infections and ultrasound was done, probably contrast media study was done of the bladder, that there is some sort of issue with the bladder sphincter that is allowing the bacteria to kind of get in the bladder. I see that with older female dogs. Urinary tract infections are very common. I believe that that's the same case is with in humans as well. So when the sphincter gets a little weaker, that may lead to urinary tract infections. And so I would look at lumbar spine. I would look at exercise, and I would also use cranberry extract. And there's one more supplement that I wanted to get, and it's D-mannose. D-mannose is used in humans for urinary tract infections and recurrence, and I would use about half of the human dose. Based on whatever product you get, just use the label instructions and use half of the human dose. Cranberry extract, and also, raw food, because if you feed kibble, that may create urine that is more likely to harbor bacteria, because there's carbohydrates, there's some starches in the processed food, and that may be also a predisposing factor.
Thank you so much.
I hope this helps.
Yeah, I'm sure it does. So hopefully that's helpful for Chantal. The next question we have is from Anya. Anya has a 6-month-old female intact Weimaraner. She has had her since she was 8 weeks old, and has had urinary incontinence since 8 weeks of age. So for quite a few months for this young dog of 6 months.
Yeah.
She's drinking lots of water. It's not that she has concentrated urine, and she feels it's a bit of a medical mystery because they did a CT scan and there's no ectopic urethra, which was the #1 initial diagnosis by the vet. She pees in the bed every day, on the couch. She's washing and doing laundry every day because of this. So she's desperate for a holistic option to try to investigate and solve this issue.
I would say use Incontia. Use Incontia in the protocol, #1. #2, based on what I know about Weimaraners, they love to be active and they love to chase balls. They love to sprint. They love to do all that. And it's very possible that your pup came with a misaligned spine. So if we are lucky and you find a good, gentle, I'm just going to say good, gentle chiropractor or physical therapist or acupuncturist, they may do some work with the lumbar area and the spine, and your dog's problem will resolve. I'd say there is like a 80% chance that it's going to be better. That I hope that it will. Keep us posted, okay?
Great, thank you. And the next question comes from Peggy. Her question is, hi, Dr. D, does a kidney supplement help a senior dog with urinary incontinence? I have the Renafood from Standard Process, and I'm wondering if it might help. Thanks.
I think glandular supplements are great for situations when there's organ failure, like kidney disease or liver disease or pancreas issues and so on. When it comes to incontinence, it is unlikely to actually help. you have to go basically the route of determining that there is no infection, no bladder stones, no polyps, no ectopic urethra, which in an older dog is unlikely. Assess exercise, assess the spine. And if your dog does have kidney disease, obviously Arena Food is a good product and good supplement, but I would not expect it to solve your dog's incontinence. So hopefully it'll be okay. I was looking at, I'll actually show you something. I was looking at our Incontia reviews, and I was really curious just yesterday. I was really curious, thinking, okay, I want to see how many people it didn't work for. And I'll open this, just a second. I'm just going to open the web page, Safari. Okay, so when I go for the reviews, by the way, you guys can actually look at all the reviews. The page has been redone. But if I click, there's 15 reviews. So there's 13 positive, 5-star, and 1-star, there's 2. So I clicked on those. And so I then discovered that one person gave us 1-star because she didn't read the label, and she didn't know that it was a protocol. She didn't know that she wasn't getting a product. And the second one said, after administering the second dosage, still experiencing incontinence issues. The homeopathic treatment was my last resort. I wish that we connected with this lady and actually told her, hey, what's going on with exercise and what's going on with your dog otherwise? Have you seen a chiropractor? Have you followed the protocol to the T? Because the protocol does describe everything that I just described in this little Facebook Live. So, it was failure on our side, to be honest, that we didn't get in touch with Teresa. Maybe we can still figure out where she is and maybe get in touch with her, Alicia. But, most of the time, if you look at everything else, it's pretty good. It's pretty positive, right? So, it's just such a simple treatment. And if you think of how many dogs suffer from this condition, and have serious problems, I wish sometimes that I had the guts to go again, as I did with the hyperthyroid treatment. I went to conference and I was put in the module that was also where one of the presenters were people who were teaching against homeopathy, how they called actually their lecture homeopathy flagrant violation of medical principles. It was quite the shocker for me to actually be put in the same module at the conference, but it probably was because the conference was majorly sponsored by all these major drug companies. And the only reason why I got in the conference was that one of my professors was actually the organizer of the World Small Animal Veterinary Medical Conference. So it was an interesting situation there. I sometimes feel like I should go out there and teach my colleagues, but I've seen so much opposition and so much. I know that there are people who are willing and open, and I should not be a coward, to be honest. But I have had so much negative experience with people kind of laughing at what I'm saying, right? So I just kind of go, oh, I may as well just teach you dog lovers and just bypass. But it's sometimes very difficult because I do feel that I would love to have a better connection with my conventional colleagues, and sometimes it's very difficult, and I don't really know why that is. So if there are any conventional vets or any vets, any of my colleagues, I very humbly ask you to contact me and let me know. I'd be very willing to kind of help you and teach you as much as I can at no charge. This is my honest moment here. But anyway, sometimes we have to vent our frustrations too, right?
It's important. How are we for time? It's 2 p.m. Pacific. We started a few minutes late. Is it okay to do a couple more questions?
Yes, of course.
Great.
Absolutely. No problem at all, as long as it takes.
Perfect. The next question is from Debbie. Debbie's dog Lacey was given Proin and was sick after 2 doses. Is this something that you've seen commonly when this drug is given, that dogs react negatively to it?
I haven't seen it commonly because I've never given that drug. If the label says that it can cause stomach upsets, and I could, frantically look up the label and see. But if you've seen it, it probably is caused by the drug, and I would try the protocol that I just presented and see whether it works. I'm not necessarily saying, you guys, that it'll work for every dog, but it's been pretty reliable for me.
Absolutely. And the next question is poop related rather than urine related, but along the same track. So this question is from Lily, and she said that her dog, when it's out exercising, will have a normal poop or two and then a really loose stool. And it only happens when she gets walks in the local park, and I assume is overexerting herself. Is that the same sort of thing?
It's a little more, well, it's kind of similar to what happened to Kaz when we brought her to the car, and I was explaining the parasympathetic and the sympathetic nervous system, because after she's exhausted, the bowel is probably much more active. Pax usually goes and has number two after he runs, right? So that's common. There can be also some sort of issue with the lumbar spine, because the colon gets its nerve and energy supply and blood supply from mid lumbar area. So if the dog runs and there's some sort of impingement, there can be a little bit of an activation of the whole gastrointestinal tract due to this, I would call dysfunction of the spine and the energy flow. So I think that dogs, and I didn't talk to you about the exercise that I love to do. I think that my ideal exercise for dogs would be tracking, sniffing, walking, light jogging, playing with other dogs, not crazy tug of war, because that misaligns the neck and other issues that I've seen. Fishing in the water. Pax loves to go in the ocean and walk in the water, right? And then he runs a few times and then he fishes again. All those kind of low impact exercises are what dogs would do. They can chase, but they chase, a rabbit once in a while, right? It's what would wolves do? Like, you don't usually see wolves running and sprinting all the time. You see them kind of leisurely walking and trotting and playing and having fun. So try to go on YouTube and see what canines in the wild do and try to replicate it as much as you can. And I really do not like ball chucking and all that, even though it's very common and I know that dogs love it. They kind of get addicted to it. And then we get addicted to see them happy and loving it. And it's a big problem. So yeah, I don't really know how to. Yeah. If you have any personal coach or therapist, just talk to them about it. Because and I'm not really actually joking even. I think that it's an emotional response, right? Like, I don't really necessarily think that it's easy. Like, it's not easy for me to take Pax away from the beach when I see that he's having fun, or say, okay, you've run enough. Now we have to go to the upcountry meadows as opposed to or pastures, and you can eat cow poop instead of running at the beach.
I have a lab, as some of the community might know, and I know we have talked about my lab Diesel on Facebook Lives before. He is super active. He loves his bowls, loves his frisbee, but it's my responsibility to monitor him and to minimize that sort of really hardcore play. And by doing that, I'm doing him a favor and just coming up with other ideas to make sure he's happy and entertained and working well so far. Fingers and paws crossed.
Exactly. There's that component. Thank you, Alicia, for saying that. There's that component of, really having boundaries, right? And knowing that dogs do not know what is good and what is not good for them in the environment that we brought them up in. If they were living in the wild, it would be no problem, right? It's like with kids. If we don't teach them cook and wash dishes and clean their room, maybe we are thinking that we love them and we care about them that way. But then their failure to launch. They're 35, they're still living with mommy and daddy, and they don't even cook, right? And so it's just, it's this, we need to really we need to practice boundaries. There's no way around it, right? And also be kind to ourselves when I go, oh my goodness, I'm being total mush and I'm having a hard time to say no to my dog. I actually don't push that aside because I know that would fester. I try to look at it and I try to see and inquire, what is the inner emotion? And usually it comes down to me knowing what it feels like when my need is not met at certain point. And I don't want that to happen to my dog, right? But then ultimately they're kind of happier when they are given boundaries. I have to show you something. He's not allowed on the couch. Maxi. Now he's pretending that he's not hearing me.
If I close my eyes, you can't see me. Amazing.
Oh my goodness. And he normally doesn't want on the bed or anything, but yeah, he wants to. Maybe he just wanted to be part of this happening here.
He wants to be part of Facebook Live. Who wouldn't really?
Yeah.
But yes, and just to follow up with what we were talking about, for me, I find that little things like making sure my dog has a little bit of on-leash time before and after he exerts himself helps him warm up his muscles and cool down the body, just as we would do as humans. And making sure they're engaged, working dogs especially, if their energy is diverted to another activity, then they can still really enjoy that. It might just take a little bit more time and energy on the human's part versus it's so easy to just throw a frisbee or a ball. So we need to get creative too.
Yeah, when dogs, thank you, Alicia, for reminding me and making that point. It's really great. A good conversation. Dogs love to have adventures. They love to go out and walk and hike. And they also like, weirdly enough, they kind of like to be bossed around. They like to be, given tasks and commands and look for the toys in the house, and then you hide them, or in the park and track them. And dogs are like humans. Like they just love to have a sense of adventure and purpose in a way.
Absolutely. And we have another question. This one's a little bit of a longer backstory, so I'll do my best to consolidate the information. This is from Pamela. Pamela has a 9-year-old dog that was diagnosed with neurodegenerative spinal cord disease. Mm-hmm. She also has lumbar and sacral compromise, which happened about 5 years ago. I'm not sure how, maybe an accident. She's on a raw diet and has been so most of her life with supplements. She gets physical therapy, holistic vet for acupuncture, cold laser treatments, and she also does a full body and core exercises. So it sounds like Pamela's doing a lot of good things for her dog. She's a rock star.
For 1% of dog lovers, she is loving her dog beyond anything else. I can see that, Pam.
Lots of effort there. The question, I guess. Yeah, the question she has is that she has started, again, 9 years of age now, she has started to occasionally leak urine when she's sound asleep. A couple of times she's had full incontinence where she's, I guess, emptied the bladder. Should she start the protocol now, even though she's not incontinent all of the time? Her activity is limited and she just is appreciative for any suggestions.
Okay, thank you, Pam. And Alicia, German Shepherd or?
I don't have the breed in front of me.
I would love to know.
With the question.
Pam, it sounds like he may be living with the German Shepherd, but maybe not. Anyway, so urinary incontinence, just to kind of start with, bring a little clarity into urinary incontinence. It doesn't really matter whether it happens when dogs are not sleeping or when they're sleeping. Basically, they can't control their bladder, right? So that's the definition of urinary incontinence. It sounds like there is a spinal degeneration and dysfunction of the spine, which often happens in German Shepherds. Sacral lumbar issues, again, often happens in German Shepherds.
Sorry to interrupt. We have the breed. Pamela has just posted. She has a border collie flat coat retriever.
Okay, border collie flat coat retriever. So an active dog. Pamela, I would be really curious to see whether, how your dog was when she was young. because it seems like she was basically just a little too hard on the body. Maybe it's genetics, maybe it's combination of genetics and exercise and her being active. I don't know, but I would definitely start her on the protocol and see what happens. I would, obviously you're doing everything else right. I'm not really sure what the exercise regime and protocol is. So that's something that you may want to reassess, especially because my sense is that you have an active dog.
Excellent, thank you. And we're now at about time, and I want to share for the community and for you, Dr. Tobias, a really nice story that we have from someone that posted. I will just be 1 second. This is from Vicky. Vicky, thanks for the comment. Her girl developed really bad incontinence. It was treated with estrogen, which didn't work. She took Dr. Tobias's advice and saw a chiropractor. Yes, it was a back injury and the incontinence went away and her back is healed. So that's a nice piece of, nice piece of info. Thank you so much for the feedback, Vicky. We love to hear these great stories of it working and making a difference.
Thank you. You guys, it makes me so happy to hear that you're actually getting it and that you're using the information and that I can make a little difference, right? It's really fantastic. And Alicia, thank you as well for pitching in, and my team in the background who's posting comments and links and so on.
Thank you, Christina.
Christina, hi, Christina. And we'll be back in a couple of weeks. Alicia, what is the date in a couple of weeks?
We will be looking at a bit of a schedule change soon, but in 2 weeks' time, it's the 29th. So we're still looking, I believe, at Facebook Live for 1 p.m. Pacific.
Absolutely. So just to let you know, I have a plan of visiting my 85-year-old mom who hasn't seen me for a long time. And Pax and I will be relocating to my homeland, Czech Republic. And we're really excited about it. We're going to be jet lagged for some time, but we will be changing the schedule in May. So we will let you know. I think that it will be probably earlier in the morning, my sense is. Correct, Alicia?
That's right. That's what we did last summer, and it worked out quite well. So we will keep the community posted for sure.
And so next time in 2 weeks, we are going to have a question and answer session, probably about 3 patients or 3 dogs, because last time we did 4 and it was too many. Next week, we are going to be probably rerunning. Usually once every 2 weeks, we rerun the previous Facebook Lives as well. And don't forget to check our podcast. I called it Not Just About Dogs, because it's not always about dogs. And if you want to rate it 5 stars, great. And if you don't like it, just be patient with me and maybe not rate for now. But send me an email. Say, Peter, you're horrible. Stop it. Anyway, have a wonderful day, evening, whatever it is in your time zone. Thank you, Alicia. Bye-bye.
Thanks, everyone. Bye-bye.